The world changed in late 2019 with the emergence of a novel coronavirus, SARS-CoV-2, the virus responsible for the disease we now know as COVID-19. Coronaviruses are a large family of viruses, some of which cause mild respiratory illnesses like the common cold. However, COVID-19 proved to be far more serious, spreading rapidly across the globe and impacting nearly every aspect of our lives. This virus is unlike anything we've encountered in recent history. It's a microscopic package of genetic material encased in a protein shell. Not technically considered a living organism, yet capable of wreaking havoc on a global scale. Its novelty meant that our immune systems had no prior experience with it, making us all susceptible to infection. The emergence of COVID-19 underscored the interconnectedness of our world and the vulnerability of even the most advanced societies to infectious diseases. It forced us to confront the limitations of our healthcare systems and the importance of public health measures in safeguarding our collective well-being. COVID-19 primarily spreads through respiratory droplets released when an infected person coughs, sneezes, talks, or even breathes. These droplets can travel up to 6 feet and infect another person if they land in their mouth, nose, or eyes. While less common, transmission can also occur through contact with contaminated surfaces. The virus can survive on surfaces for varying periods, making hand hygiene crucial in preventing its spread. Once inside the body, the virus targets cells in the respiratory system, particularly those lining the lungs. The virus uses its spike proteins, which resemble crowns, hence the name corona, to latch onto these cells. After attaching, the virus injects its genetic material into the host cell, hijacking its machinery to replicate and produce more virus particles. This process of viral replication damages and destroys healthy cells, leading to the respiratory symptoms characteristic of COVID-19. The severity of the infection can vary greatly depending on factors such as age, underlying health conditions, and the strength of the individual's immune response. Upon detecting the invading virus, our immune system launches a multifaceted defense mechanism. White blood cells, the soldiers of our immune system, work tirelessly to identify and eliminate the virus. Some white blood cells, like neutrophils, engulf and destroy infected cells, while others, like T cells, directly target and kill virus-infected cells. The immune system also releases signaling molecules called cytokines, which help coordinate the immune response and recruit more immune cells to the site of infection. However, in severe cases of COVID-19, the immune system can overreact, leading to a phenomenon known as a cytokine storm. This uncontrolled immune response can cause widespread inflammation and damage to healthy tissues and organs, particularly in the lungs. This is one reason why COVID-19 can be so dangerous, as it's not just the virus itself, but also our body's response to it that can lead to severe illness. Section 4. COVID-19 versus the flu, a comparative analysis. While COVID-19 and the flu share some similarities, they are distinct diseases with important differences. Both are respiratory illnesses that can cause fever, cough, fatigue, and body aches. However, COVID-19 is generally more contagious than the flu and can cause more severe illness in some people. One key difference is the incubation period, the time between exposure to the virus and the onset of symptoms. COVID-19 has a longer incubation period than the flu, ranging from 2 to 14 days, while flu symptoms typically appear within 1 to 4 days. This longer incubation period for COVID-19 contributes to its silent spread, as people can transmit the virus before they even know they are infected. Additionally, COVID-19 can lead to a wider range of complications, including pneumonia, acute respiratory distress syndrome, blood clots, and multi-organ failure. While the flu can also cause serious complications, particularly in high-risk individuals, COVID-19 has a higher mortality rate overall. Section 5. Combating the pandemic: strategies and importance of early action. Combating the COVID-19 pandemic requires a multifaceted approach that combines individual responsibility with public health measures. Early and decisive action is crucial in slowing the spread of the virus and mitigating its impact. One of the most effective ways to prevent infection is through vaccination. Vaccines work by training our immune systems to recognize and fight off the virus without causing illness. Widespread vaccination helps to reduce the spread of the virus and protect those who are most vulnerable to severe illness. In addition to vaccination, other preventive measures include wearing masks in public indoor settings, frequent hand washing with soap and water, social distancing, and staying home when sick. These measures help to break the chain of transmission and reduce the virus's opportunity to spread.